In today's podcast, we're going to talk about a brand new study that found that exercise is protective for the current public health problem that's going on. It's a very large data set involving 100,000 subjects, and researchers in South Korea found that regular exercise is linked with a reduced likelihood of being infected with SARS-CoV-2. So this is the very first time this has been published. We're talking about a large cohort of over 100,000 subjects that have been tracked for the past 5 years between January of 2015 and July of 2020. So really interesting data. Now, what's not new here, and we've known this for a long time, is exercise is linked with reduced likelihood of having severe disease and death. But again, the importance of this video, and as you continue to learn more about this study, is for the very first time, exercise is associated with a reduced likelihood of being infected. And this was published not in the Journal of Bodybuilding Bro Meathead Science. This was published in the journal, the British Medical Journal. So this is arguably one of the top, say, maybe 5 reputable peer-reviewed journals in the world. So a very reputable journal, large data set. And we're going to dive into this because this data has been collected since 2015. And what these researchers did during the outbreak of the SARS-CoV-2 virus is they started to correlate infectivity, positivity, severity, death, and all of that. And we're going to unpack these details. Now, these are very statistically significant correlations with regular exercisers, and they stratified for resistance training versus aerobics, inactivity, sedentary activity, and all of that. And the combination of 150 minutes of moderate to intense physical activity per week offered the best benefit. So that's sort of the take home here. And again, the major take home here is reduced likelihood of even contracting the virus. Now, the authors admit in the sort of shortcomings and limitations of this study that perhaps there are confounding variables, like people who exercise at least 150 minutes of moderate to vigorous physical activity per week might eat better food. They might adhere to other measures that reduce their likelihood of being infected. But again, they tried to stratify for a lot of these confounding variables, and they use all these different cohorts, and it's a really fascinating paper. So I wanted to take, today's podcast, dive into the details. Then we're going to get into another study that tracked infectivity and so-called long haul symptoms and things like that with elite athletes in Europe. Because we do hear all the time that healthy people are dropping like flies. And what this analysis in over 111 elite athletes in Europe found that only 2% of the infected athletes had even a moderate case. None of the athletes, the elite athletes that is, died. None of them ended up in the hospital. So I just wanted to share this paper. This was, again, published in another reputable journal. So I want to welcome you back. It's Mike Mutzel. I'm grateful that you are here. If you're watching on YouTube, please leave a comment in the comment section. That actually really helps. Again, if you think our videos should get more views, leave a comment and hit that like button. If you're in iTunes and you're digging this, I would be so honored if you could leave us a little bit of feedback in iTunes. If after watching this or listening to this all the way through, you thought this was helpful, that really helps our show. So let's dive into it. So the title of the paper is Physical Activity and the Risk of SARS-CoV-2 Infection, Severe COVID-19 Illness, and COVID-19 Related Mortality in South Korea, a nationwide cohort study. Again, the size of the cohort is 100,000 people. And so this was published in the British Medical Journal. Now, here's kind of the punchlines here. So I know a lot of you are short for time. You're like, okay, give me the punchline. How much exercise were they doing? How much exercise should you be doing? And maybe let's just hit a pause here because I think, well, let me read to you this. Okay, so this is the very first large-scale population nationwide study to investigate the association between physical activity and risk for COVID-19 infectivity. I want to say that again. COVID-19 infectivity. So what they found is that regular exercisers have a reduced probability after adjusting for various other confounding variables of being infected with this virus in the first place. Now, why are we talking about this right now? Because if you turn on any news, whether it's local news or national network television, okay, you're going to hear all about the Delta variant. Cases are increasing. We might undergo new lockdowns, gym closures, school closures, cancel sports, you name it, okay? So that's on the horizon, and I fear and I predict that's what's going to happen this fall and winter. We are going to see new restrictions, new mandates, new all of this. You know, there was a small little outbreak over the 4th of July, and this was published by the CDC in their Morbidity Mortality Weekly Report. It was like 469 cases, and there was 5 hospitalizations, and that was enough data to just restart this new mask mandate. Okay, so again, we're hearing more and more about this because some of the people that have been immunized, their viral loads are high, and so we're hearing much more about this. So you would think that this new paper, again, published in the British Medical Journal, would be front page news. It's like, wow, we have a really low cost modality that's effective, that can reduce potentially the definitely severity and reduce death, but it might even, if this data set is translative into other nationalities. Remember, this was published using South Koreans, right? They have different genetics and prevalence of those ACE2 receptors and all of that, but still, this should be front page news. If we're concerned about cases, we should be promoting exercise. When was the last time you saw MSNBC, CNN, CBS, ABC, or NPR suggesting 150 minutes per week of vigorous or moderate to vigorous exercise? I have not seen any of them talk about that. Maybe you have. If you have, please leave a comment below with a specific video or link where these networks are promoting exercise as it relates to the public health problem, because I would love to see it. I have not heard Dr. Fauci. I have not heard Dr. Walensky. I have not heard Joe Biden. I have not heard anyone promote exercise. Okay, for some reason, that gets relegated as a conspiracy theory. We're promoting health. We're trying to get everyone healthy, and I think this data should be considered in that light. Okay, so here we go. Physical activity is one of the leading determinants of health, and a lack of adequate physical activity is estimated to be responsible for 6 to 10% of the global burden of major chronic diseases and 9% of premature deaths. So for background, exercise has really been studied in the context of preventing illness when it comes to non-communicable diseases, hypertension, high blood pressure, preventing mortality and so forth for disease-specific and all-cause mortality, multiple chronic diseases, metabolic syndrome, type 2 diabetes, cancer, cardiovascular disease, and much more. But this is, again, one of the first studies, and we're going to talk in just a moment about the mechanisms by which exercise might affect the immune system as it relates to the current public health problem. So again, more background here. The total observational period was from January 2015 to the 30th of July 2020. And again, they had this data set. I believe South Korea has some sort of nationalized healthcare system, so they were able to collect the data. They already had physicians, had been asking patients, hey, are you performing the recommended aerobic physical activity of 150 minutes per week recommended, and then having some moderate intensity, about 75 minutes per week of moderate to vigorous intensity exercise. So what you're seeing here is the adjusted relative risk for contracting COVID-19, having severe disease, and dying. And so again, what these researchers did, and the details are a little bit complex, so I'm not going to go into all of them here, but they wanted to minimize the effects of confounding variables. Like, okay, people who do a lot of activity, they also engage in healthy behaviors. So they try to organize people in all these different cohorts and look at the data different ways to see if they can come up with the same results. And what they found is that over and over again, no matter how many different cohorts, how they organize this into smokers and non-smokers and intense exercise or combining exercise with aerobics, they found very similar patterns here. And you're looking at around a 30% risk reduction for death, for infectivity, and for severity. And so there's a bunch of different ways that this can be interpreted. And again, they were trying to reduce the bias in their findings. And so what they found is that having these metabolic activity units between 500 and 1,000 per week offers most of the benefit, and being highly active, having over 100 or over 1,000 METs seems to be the most protective, especially against death. So that's what's kind of interesting here. And so the combination, and this is what's interesting. So I'm looking at figure A here. The combination of muscle strengthening and aerobics offered the best bang for the buck, as you can see here. So that's something that we promote on this channel: hiking, walking, riding your bike, but also doing resistance training. I'm a huge fan of at least the minimum, friends, is 3 days per week. Upper body pressing, lower body pressing, upper body pulling, lower body pulling. Definitely check out the podcast we did with my own personal trainer, Dan Stephenson. So our findings reported that the recommended key target range of metabolic equivalent task of around 1,000 METs minutes, so being metabolically active 1,000 minutes per week, was associated with the maximum beneficial effect size for reducing risk of SARS-CoV-2 infection, severe COVID-19 illness, and COVID-19 related death. The length of stay in hospital was shortened about approximately 2 days in patients with both aerobic and muscle strengthening exercises. Again, if you're hitting that target of 1,000 minutes of metabolic activity per week. And so just think about that. Try to strive for this. And so what that might look like is 8 to 10 to 12,000 steps per day and doing some sort of resistance training. Now, let's talk about the mechanisms. I know a lot of you like to review some of the details and the mechanism of action and so forth. So the findings of the study suggest that public health policies and strategies to include physical activity at the population level may reduce the risk of SARS-CoV-2 infection and minimize adverse consequences in patients with COVID-19, encouraging individuals to have a level of physical activity during the COVID-19 pandemic should promptly and actively be considered on the public health level, because during the ongoing pandemic, measures have been taken by governments and politicians to control transmission and slow the spread with lockdowns and social distancing and all of that, which has substantially decreased people's daily behaviors and movements. Routine and so forth. People are they're out of their routine. They're not moving like they used to be moving. So previous studies have described the health benefits of physical activity and so forth on the immune system. And so what this study and what they suggest mechanistically is going on here is habitual exercise has the following beneficial effects on the immune system. Enhanced immunosurveillance. So this is just the ability of your immune system to sort of seek out pathogens and just look around like a security guard. So they increase immune surveillance with upregulated immune activity and metabolic health by affecting the immunoglobulins and the anti-inflammatory cytokines, reduce systemic inflammation. So we've talked a lot about systemic inflammation and how it's problematic. So everything from various cytokines and things like that are taking a burden or impacting the immune system in a negative way. And also improved regulation of the immune system and delayed onset of immunosenescence. So later this week, we have a whole podcast about how exercise affects the immune system as it relates to immunosenescence. It's going to be fascinating. I think you'll dig it. So you need to move. If we're serious on a population level about making people healthy and keeping people safe and healthy, we need to be promoting exercise. In conclusion, this study provides new evidence that physical activity, including both aerobic and muscle strengthening exercises, led to a substantial reductions in the infectivity of SARS-CoV-2, risk of poor outcomes, and death related to COVID-19. Recent studies reported that total physical activity has significantly decreased between and immediately before and during the COVID-19 worldwide pandemic across all age groups, kids to elderly to everyone in between. And so new evidence continues to mount that decreased physical activity during the COVID-19 pandemic is a critical threat to public health. Okay, we've talked about that before. Why are we closing gyms? Why are we discouraging people from exercising? Its impact on infectivity and clinical outcomes has not yet been clearly defined. The results of this study demonstrated that the importance of physical activity in decreasing the risk of infectivity, severity, and mortality of COVID-19 can be interpreted and can help to implement future guidelines. So again, I think this should be front page news. I would encourage you to share this with a friend or family member. I don't know why this is not being discussed. There was a related study that we talked about back in April, and this was published by the Kaiser Permanente group involving over 40,000 subjects. And guess what? They found a similar correlation with increased related physical activity and metabolic activity units and so forth. But they did not show this correlation with infectivity, but they did show regular exercisers is linked with a reduced likelihood of severe disease and death. So this should be front page news if we are serious about saving lives, if we are serious about using our power as public health officials, as politicians, as our institutions, whether it's our schools, our businesses, our employers. They should be encouraging, because there's a lot of mandates, there's a lot of things coming down the pike. Why aren't we also incentivizing exercise? People who go to the gym or employers should be paying for gym memberships. I mean, come on, this should be front page news. Now, this next paper we're going to talk about, it's titled Elite Athletes with COVID-19, Predictors of the Course of Disease. Now, I'm sharing this with you because I'm sure you have friends or family who say, well, oh my gosh, well, Sally or Mike, I've heard these comments, I've seen them, I've heard these arguments from friends or family. They often know one or two athletes through a friend of a friend or directly that had a severe disease. And they're saying, well, because of this one person that they know, that means that everyone is equally likely to have a severe outcome. But again, I want to share data, large population data. This is over 111 elite athletes. And again, this is important because we're hearing on the media that it doesn't matter what you do, like everyone is equally as vulnerable. But that is not really scientifically accurate here. So this data was collected from elite and national level athletes in Europe. And what they found is that the severity of COVID-19 was mild in 82% of athletes. So mild means you don't need to go to the hospital. You don't get put on a ventilator. You don't die. Mild means mild. So moderate disease, so a little bit more moderate, was in 2% of athletes. So do 0.02 times 111. That's the number of people who had an even moderate case, okay? So and no one died. No one died. Okay, so these are athletes between the ages of 26 and 35. And so it actually found that male athletes were more likely to be in the moderate, to have a moderate or more symptoms compared to females, which is interesting because most oftentimes when you go to the grocery store or you're out in public, I would say, just anecdotally, I haven't run the numbers, but women are much more compliant with regards to social distancing and masking, yet the data shows that women generally have a little bit of a protection compared to men, statistically speaking, in terms of disease severity and things like that. So asymptomatic subjects were younger and predominantly female. So there's a higher percentage of asymptomatic females in this elite athlete study. In 18% of the subjects, symptoms were still present 20 days later. So we're hearing that a lot. What about long haul COVID and how prevalent is this? So, and I would say with just my anecdotal, N of 1 infectivity when I got SARS-CoV-2 in December, it took about 4 weeks. It was like 2 kind of achy days. I was still active. I built a deck actually in our sauna. I was active, but I knew I had something, so I canceled social plans. And when I was around my employees, actually, the first day I was because I didn't know what it was. I was totally distanced from anyone because I did not want to get anyone sick and so forth. And then that Friday, so but 2 days later, I wore a mask and had employees wear a mask and got no one else sick, thankfully. But it wasn't like this real bad cold. But it seemed to linger on for about a month, where you kind of feel, again, not achy, but just a little tired, just like, what? But then it's hard to disentangle because this is right around the holidays. It's the darkest, time of the year. It's raining in Seattle, so it's kind of hard. But looking back on it, was like, yeah, I definitely felt a little bit off for about 2 to 3 weeks, I would say. But again, I just pushed through. I think energy is created. You increase your energy by just doing more stuff. You create energy. If you sit around and don't do a whole lot, then you can't expect to sort of create energy. And I know that sounds weird. It's just a mental thing. I try and encourage clients to just create their own energy. If they feel fatigued, go outside and do some push-ups. Take a cold shower, doing a cold plunge, do something, and then just think about the people that you're going to benefit by having that energy. I really like to manifest, as weird as that might sound. Anyway, there was no differences in antibody responses between the different groups distinguished by sport. So it's not like rowers had higher levels of antibodies compared to, say, sprinters or anything like that. And there wasn't much of a difference between gender and so forth. And antibody responses didn't correlate with BMI or age. I thought that was a little interesting. So the severity of COVID-19 in athletes is predominantly mild and without complications. Athletes can return to sport after 2 symptom-free weeks, and additional heart screening is usually not required, they say. Determination of antibodies has been shown to be a useful indicator of previous COVID-19 disease. And I will say another determinant of previous disease is the T-cell immunity assay. I shared with you that before. Go to t-detect.com, check it out. The researchers go on to say COVID-19 symptoms in athletes has been scanty with regards to the academic literature. A study showed out of 26 competitive college athletes with COVID-19, 46% of them reported mild symptoms, while 54% were asymptomatic. So again, I'm sharing this data because it sort of piggybacks off the first study that we talked about in the British Medical Journal that shows that exercise is protective. The similar percentage of asymptomatic athletes was observed by another study group who studied 434 soccer players, of whom 36 had COVID-19. And again, so 58%, and again, these are, I think, young collegiate athletes, were asymptomatic. Okay. So we just got to think about that. Now, I would imagine that in the general population who doesn't exercise, the prevalence of asymptomatic is probably a little bit lower compared to athletes. So again, it supports this notion that exercise is helpful. In 22 COVID-19 positive collegiate athletes examined by Clark et al., the majority of them, 77%, experienced mild illness, while 23% were asymptomatic, in which is only slightly above the results obtained in this present study. Okay, so the present study included 131 athletes in Europe. Most were under 30. After COVID-19 infection, both symptomatic and asymptomatic infections were recognized in only 16% of these cases. The severity of symptoms shown in the present study, and the vast majority were mild, seems to be consistent with the general predictions for the same age group. So that's it for today, friends. I will put these two studies and the associated images and charts and all of that, and the related the mortality and morbidity weekly report from the CDC in the show notes. If you're still here and you're enjoying it, you can hit that like button. And I do want to let you know that we have recently updated on our sister company, MyoScience, the MyoRelax and Calm. It now features potassium, which is a great mineral that's involved in electrolyte balance and supporting healthy hydration. And it also has glycine. So you have glycine, potassium, you have magnesium, you have taurine, you have L-theanine, you have GABA. It's an awesome formulation. Along with myo-inositol. So that's been updated. It's now stevia free. Definitely check it out over at myoscience.com. You can use the coupon code podcast. And as always, I'm just grateful that you're tuning in. If you feel that this message resonates with some of your friends and that exercise should be part of our containment strategy, please share this with them. I would encourage you to do that. And as always, I'm just grateful that you tuned all the way to the end. We will catch you in a future podcast down the road. Have an awesome rest of your day. Bye now.